Hey, what's up, everyone? It's Dr. Glenn Vo. I am super excited. I've been working really hard to get this person on. And again, we've heard so much about AI. I want to say that AI is probably the term of this year, right? Like it's the most overused term, I think. But again, a lot of people don't understand AI, especially when it comes to dentistry. It can definitely help us become better clinicians and make us run our practice a lot better. So I have here one of the leaders in the AI space for dentistry, the CEO of Overjet, Dr. Wardah Inam. Wardah, how are you?
Hi, Glenn. I'm good. Thank you for having me here.
Oh, well, I'm so excited to have you on. Now, before I get into what Overjet does, right, and how it can help us as clinicians, help our practices, and help our companies, I have to ask you this question. Um, what made you want to work with crazy dentists like myself? That's crazy profession. What made you want to work with us?
I think for me, I was working on MRI data at the time that I changed my dentist and got a treatment plan, which was very different than I had received before. And that got me interested in dental diagnosis. But then I think for me, as the more I learned about dentistry, the more I learned about not only the dentistry as a profession, but the social impact, etc. I got more and more obsessed with dentistry. I then, started shadowing dentists, and I think that's when I was hooked. Like for me, it was I like fell in love with the field. I fell in love with the fact that what dentists have to do. It is a significant amount of cognitive overload and then manual overload as well. Like with working, not only as radiologists but also as surgeons, etc., and really trying to provide the best care for the patient, usually on their own with a few people around them. It's not a big system that they're part of, apart from the DSOs themselves. But I think it's just an exciting profession, and the impact for me is very important, and the impact it has on human lives is significant. So I think that's what really got me hooked. And I started spending more time on dentistry than I was spending on MRI data. And that's when I quit my job, not knowing what I wanted to do, but knowing that I wanted to work in dentistry and really help impact patient care.
So I want to let everyone know, obviously, and Dr. Wardah's not gonna talk about her resume and her credentials, but I am because it's very impressive. So she is a PhD from MIT, electrical engineering, computer science, and in true engineer, because we know about the engineer mindset. We have a lot of patients that are engineers and whatnot. Some of us have that engineer mindset as dentists as well. But in true engineering mindset, you saw a problem and you had to find a solution. Is that fair to say that's how you kind of got into dentistry? You saw a problem, you got this treatment plan, and it was a little different. You saw a problem, you're like, there's got to be a better solution for this. Is that fair to say that?
Absolutely. And saw problems and started to like think about like whether there was learn more about it. Like I was not an expert, and I'm still not an expert. I'm still learning every day from our customers, etc. But then learned enough that for me, it was something that I felt very passionate about and felt something that I could make a difference, and we should make a difference as well. And I think that's when I could not think about anything else apart from dentistry and apart from trying to do something in this field.
Well, I will tell you, like the Overjet platform, and we're gonna talk about it now. I mean, again, at the end of the day, it makes the lives of the clinicians a lot better. So imagine just, imagine our life before the internet, right? Like before Al Gore said that he invented the internet. Before that, right? Before that, imagine how we had to get our information. I mean, Wardah, you're probably, you're probably old enough to remember this, but I remember I had to go to the library and go grab something called the encyclopedia. And when I'm writing my reports, I had to go get it, right? I had to get everything manual. I had to when I went to the library to get the book, I had to pull out this little box called the card catalog and do all that stuff. And now when we think about it, imagine going back to that, it doesn't make any sense. When Overjet came out and I saw what it could do, it almost was like the internet was just created, right? Like we've been diagnosing for years, like I mean, decades the same way. And then all of a sudden the switch turned on. So talk about, the whole journey there when you guys had this working, like something that could go to market. You work with a lot of great dental advisors. You showed them. Was the How was the reception initially? Because again, I remember when I first saw this, I thought, hey, I like technology. I was excited. I was like, let's go for it. And then there were some people who were like, wait a minute, this is not going to be as good as me. I'm a human. I'm a good clinician. All this. Talk about like that situation when you kind of brought this to the advisors and you talked to other dentists, and talk about what the challenges were and how did you kind of like push past that. And now, of course, we can't. I mean, when you think of dental AI, you think of Overjet. So talk about that.
So Glenn, it's a very interesting question because and makes me think about that time. I was the first dentist I connected with and wanted to learn more about the pieces there, and trying to pitch them this idea. The first dentist was not in favor, so they said that doesn't make sense. Like, we know what we're doing. We're pretty good at this anyways. So that was one. The second dentist who I met was absolutely different, and that somebody I shared an Uber ride with a person, and I tried to meet more dentists. So I'm talking to this person, and they tell me that they have a friend who is a dentist, and I said, "Oh, can you introduce me to that friend?" So that's how I met the second dentist.
Yeah.
So the first dentist was in my building. The second dentist was somebody I had to get to, and they were, interestingly enough, they were also professor at Harvard Dental School, and they had their own dental practice. So somebody credible who knew a little bit about technology, but knew a lot about dentistry as well. So I basically told them about at least the problem that I felt that existed, and there could be a solution, and this is what we are thinking about, and this is like just. I won't say even proof of concept, but very early ideas around how this could take shape, and they were fully supportive. So I think it was one of those things where I think some dentists could see it, some dentists were still thinking about how it's done currently and why do they need the technology. But I would say that really the second dentist really had that impact. And then of course we've had, even till now, like there are people who are for it like any other technology, and then people who don't think they have the need yet. But I do believe the way you said it, Glenn, like whether it's internet or whether it's your mobile phone, right? Like our parents, etc., were not that big into even internet. I remember when internet came in and we were spending a lot of time. Our parents were not, and now tides have completely shifted. Where I feel like it's hard to get our parents off internet and say, they're connected with their phones and WhatsApp and all these other tools. So I think it is something that it's still early stages. So we do need to improve some of the stuff. It has to get there needs to be less friction in the whole process. It needs to. So there's a lot of improvement that's going to happen. But this is the tip of the iceberg. There's a lot to happen in the next few years, and we're excited about making that happen.
Well, I am excited too. So for those who, maybe they've been, their head has been down, doing dentistry the whole time, not even put their head up and not even paying attention what's happening in the world. Okay, for those people there, because again, when you think about AI, you think about dentistry, you think about Overjet. But for those people who maybe they're just doing dentistry and they don't pay attention to anything, explain what Overjet is and how it can help them not only as a clinician but also a practice owner. Because again, when people think about AI, a lot of times they think clinical, but I think of it from a business standpoint, right? The business of dentistry, is you want to get paid, whether it's through insurance or your patients or whatnot. This is a tool to make it easier. So talk about those two things, that how Overjet helps not on the clinical side, but also on the business side.
Absolutely. So I think one thing to start off with is I think dentists are already doing a lot, right? Like they're superhuman, doing all these different pieces, trying to be clinicians, trying to own a business, trying to be an example for their staff, be there for their patients. So there's a lot that they're doing. But they also use technology, right? Like, they use X-rays to identify or make a diagnosis. They use different tools to do the procedure. So I would think of this as any other technology, which helps dentists in doing their job, but doing their job more effectively, the same way that these other technologies help them. But the way to think about Overjet currently is we use artificial intelligence, and in this case, more computer vision and natural language processing to take clinical data or dental data which exists currently that either you've acquired through imaging, or you added information into the practice management system, being able to read that, make sense of it, and then provide a valuable output that can help not only in the diagnosis, of helping make a more comprehensive diagnosis such that nothing gets missed, everything is identified effectively. The same thing that probably a hygienist does for the dentist, right? When the dentist walks in, the hygienist identifies all the different pieces. So think of it as an assistance to the dentist in making a more comprehensive diagnosis, and then providing insights. Looking at that data, being able to say, okay, the ways that you can actually improve that diagnosis over time, or in terms of protocols that are not being followed, being able to like bring out those insights in a very digestible manner every day, such that people can act upon those and improve those clinical metrics that you can actually see overall. So when say Overjet software gets installed, we actually analyze the practice, all the active patients in the practice, and understand where is the practice at. And every practice has areas that they're excelling at, areas that they need improvement in, and being able to then think of it as an analysis of the clinical performance, and then saying, okay, how do we actually improve that? What metrics do we want to move? And then having tools to be able to move those metrics. So that in a nutshell is what we're doing right now at Overjet. But as I mentioned, there's a lot to be done. There's a lot to and other ways that we can help dentists in doing their clinical job, and more, I would say, in diagnosis, but more importantly, in how they run their business, insights from their business, which they that they can now glean from the data that they've collected in terms of what are areas that they need to focus on and help improve, whether it's with the hygienist, with assistants, etc.
Well, there's one thing that I want to point out to everyone if they're listening right there. Not once did Dr. Wardah say, no, this is the Overjet is making the diagnosis for you, like it's making the decisions for you. So again, for those who are like, hey, I don't want to work with AI because I'm the one who makes the diagnosis, I trust my own eyes, all those things. Not once, okay, I want to point out, not once did she say this is going to make the diagnosis for you. What I like for you guys to think about, and Wardah, I mean, just correct me if I'm wrong here, but it's almost like you can write a report or a letter or a document, paper and pen, right? You can certainly do that. Does the job. Or you can go into Microsoft Word and type the same document. But the difference is in Microsoft Word, you can spell checking, you can do word count, you can do all these things. At the end of the day, you're still the captain of the ship, right? You're still writing. No one's writing. Now, we're not talking about ChatGPT here. That's a whole different episode. Okay, so don't worry about that. But you're still writing. The only difference is that you have extra tools to make you better. Dr. Wardah, would you say that that's kind of like the role of Overjet when it comes to the clinician looking at his data, his or her data, and using Overjet to maybe just make things more efficient? Would you say that's kind of a fair assessment, fair comparison?
Absolutely, and it is, because Glenn, there is so much that data that a dentist has to analyze. I think as dentists, people don't realize this, that how much data that they have to analyze. But if you look at it as outsider, look at all the period chart information. You're talking about hundreds of data points. If you actually took all the data points, you're talking about at times 18 X-rays. You're not talking about one X-ray. You're talking about 18 X-rays. Different angles with low resolution that somebody has to look at, and they have to make this diagnosis while the patient is in the chair. Like it's a very short amount of time, and while the patient is like waiting for them to give an answer to them and talk to them as well. So I think it is just the environment and the time and the job that they have to do. It's actually pretty difficult. It's not an easy task at hand. Like you've seen those X-rays. It's they're very low resolution in terms of trying to actually identify especially incipient carious lesions, even bone loss sometimes, etc. So these are like not easy decisions that are being made. So you need tools to help you, whether it is, as you said, spell check on documents, or on your imaging softwares right now, you have filters that you apply so that you can actually make a diagnosis better. Thinking of it in the same way, bringing that, for example, the x-ray from that black and white into colored, so such that you can actually communicate more effectively with the patients. When you put the quantifications, now you don't have to say, hey, there's more bone loss. You can say, okay, look at the 4 millimeters you're seeing. It should be around 3 millimeters. That really helps in better communicating with the patient, and the patient understanding what the dentist is saying more effectively as well. So I think your analogy is spot on.
Well, and again, for those who are, if you're not convinced yet after what Dr. Wardah just said there, I don't know what else is going to convince you, right? Because at the end of the day, it's about the evolution of the industry, right? We were talking about X-rays just now. I mean, before it was the film X-ray, and I have to admit, everyone, I am old enough to say that I did work with film at one time. But doing the film and looking at that little film, and now the digital X-rays and blowing up, and now working with an AI platform like Overjet to give you even more data. Because look, guys, I'm human. We're all human. And what humans will always do is they'll make mistakes. They'll miss few little things, right? We're not perfect, right? But we can get more closer. We can get a little bit closer to perfection by using something like AI. Now, Ward, I want to also talk about something that's really important. We talked about the clinical side. We talked about all these things. That is a given. People should, that alone should be something for you to get interested in AI and possibly talk to Overjet. But something I want to point out that is unique to Overjet is that you guys do work with some insurance companies. Now, I personally think that's a good thing. Sometimes people will say, wait, they're working with insurance companies, insurance is the enemy and whatnot. But I would say this, working with the insurance companies will give you a little bit more insight of what they're looking for, especially working with Overjet. Would you say that was kind of like the rationale there when you were working, working with insurance companies, so that maybe then you can also help the clinician side, because you guys understand what everyone is looking for? What's the rationale with working with them, and how were you thinking to translate that to the clinicians?
So Glenn, as we look at the industry, we're not in a good position where the dentists or practices don't trust the insurance companies, and insurance companies trust, say, the dentist. And I think it's not good for the patient in the end, right? Like, clinicians know what they're doing. They are, trained for this. They have the degrees for it. They've spent their lives getting more experience in providing dental care as well. Peers have a role to play, which is provide the right for the treatments that they need to pay out for, being able to pay those out. But they have their own role to play as well. I think just because the way the industry has been set up, where there is lack of transparency, there's lack of even decision making, understanding of decision making of the insurance companies, I think that adds to the distrust between, I would say, both sides. So I think, at least the way we look at Overjet's role, we are here to help the patients get the best care, and for them to get the best experience, and for insurance to pay out for the treatments that are medically necessary as well, and that need to be done. For us, to make reduce friction, make it seamless, make it much more efficient, like that's where we want to go.
Well, and I will say this, that there's an advantage, right, to be using the Overjet platform when that possibly the insurance company that you're working with is using the same platform. You guys are looking at the same thing. You understand what they're doing. So I think that is actually a positive. I think it's a positive when Overjet can work not only with the doctors, work with the insurance companies, because at the end of the day, what you were saying is that we're looking at the same data. We're looking at the same stuff here, right? Like there's no argument there. The measurements there, AI, there's no, again, subjectivity that we were just talking about there. So I see that as a positive. And again, like, congratulations to you guys to building that bridge there, because I'm sure in your short amount of time in dentistry, you've seen the battle between the clinician and the insurance companies. But again, this is a great bridge, because at the end of the day, we're looking at the same stuff. There's no argument there, right? There's AI doesn't have any bias and doesn't have any, it's not going to argue back with you. AI is just providing what they see. So again, I think that's a positive there. And on the same note there, is I'm not sure if you could tell me how many different insurance programs that you're working with right now, but is that something that's growing? Are you guys getting more? Is it safe to say that you guys might have the majority of all these insurance companies that I see in my practice working with Overjet? How does that look?
Yeah, so we are working with majority of the top carriers
Okay.
right now. That seems to be growing as well. And I
So the
think
trend
it's
is there's probably going to be more.
there's definitely going to be more. And also, I think from their part, we when they were doing or where they're looking at other solutions out there, came out to be the most accurate. And I think in this case, accuracy plays a huge role because you want to make sure that the right decisions are being made and the right review is happening as well. And I think for us, it is about how do we accept these uh, and how do we get these paid out as quickly as possible.
Well, before we shift gears, I will say this. I will make this one comment. If Overjet is good enough for these I wouldn't even say million, maybe billion-dollar companies, if it's good enough for them, it certainly is probably good enough for us, right? So I'm going to leave that at that. So again, that's the proof right there. Okay, so we're going to shift gears here because we talked about Overjet a lot, but you're an amazing entrepreneur. You have, again, we talked about MIT, you just literally seeing a problem in dentistry and wanting to find a solution there. And there's so much to learn from, not just from Overjet, but just from you personally. So I'm going to shift gears here. We're going to ask some business questions. The first thing is that obviously you're a busy person, and I want to ask you, someone with the busy schedule you have, what is a tool or what is a tool or a technique you use to be able to squeeze in all the things that you do? You're the CEO, you have family, you have, other things outside of business, and you're able to manage everything. What is it? Give us either a tip or a tool. It could be something like a digital app you use, or maybe it's a routine, a mindset routine you do. Share with us what tool you use to manage your busy schedule and have time for all the things that you need to have time for.
So one thing is there are no shortcuts, right? So if you're building a something meaningful, like it requires hard work and it requires the time and it requires, that's one that I think is something that you actually have to put, especially, at the stage we're at where there's a lot to be done. But in terms of, I think, just making sure and thinking of it, the same way as we think about it in the company, that we give an analogy of playing elite sports, right? If you're playing elite sport and you have to perform every day at your best, then you have to make sure that you're keeping the other pieces that are needed. For example, as you can see, I'm wearing an Oura ring. That means I'm monitoring my sleep.
Yeah.
I'm monitoring the other vitals that are needed as well, because if you're not getting your sleep, can't make the best decisions, you can't do other things as well. So I would say this would be probably, a small piece of it, that, thinking of it as if you need to perform every day, you need to be in the right physical and mental health to be performing at that level every day as well. Other than that, in terms of, the tools we use, internally, like I use and use in the company, definitely like Notion as a tool to really make sure that everything is noted down in terms of what needs to happen, any thoughts I have, etc., so that I can make sure that I'm bringing them up in the right meetings. I'm having it all structured. So I think that's one where I would say I'm pretty good at, like, putting everything in one place. Also, I use a lot of voice notes. So this is one where I can type pretty fast, but I can probably talk much faster than I can type. But also, I might be, out of my not in front of keyboard. I'll definitely do a voice note, and that really helps, for people to understand your context, for them to understand your tone, for them to understand. A lot of information gets lost. And the third would be probably similar to the voice notes, is actually a tool called Loom for videos. So like if I'm trying to explain to folks, I would quickly do a Loom video, show what I mean there. It's probably a 2-minute video, and it saves us like a 30-minute meeting to be done. So I think those are probably some of the tools that I've used very frequently, probably every day, to ensure that I'm performing at a higher level.
Well, I'll tell you what, those are some great tools, but you laid out a very straightforward but very important. At the end of the day, you can have all the tools in the world, you can have all the shortcuts, but you just have to put the work in, right? At some point, there's no hacking anything. At some point, you just have to sit down and do the work. And I think that's something that everyone should listen to, because we're always looking for shortcuts, but sometimes you just have to sit down and just do the work. So that's a great one there. Now, Wardah, with every success, we see different entrepreneurs, different dentists, different companies. You see all this big success, right? And you're thinking, wow, like they just had it all together. But we know, right? We know that most success has been paved by failures, right? It's the foundation of all this success. Share with us, and if you're like me, right? I made a lot of mistakes, enough to learn, like write a whole book about, right? And I'm not going to ask you to name everything, but name one that, maybe a mistake you made that you learned something really significant from, that our listeners can learn something from.
So I'm probably glad I'm like you. I make mistakes every week, every day, probably, and because we are doing things that, again, nobody's done. There's a lot to be done, and then we're pushing the boundary on what needs to happen as well. But I would say, the most painful mistakes I've made have probably been in hiring, and I would say it's whenever I've taken the shortcut there, like I've where not taken the assessment or not done the reference check, or I think that's one which has hit us pretty hard. And why that's the case is because if in the end, to build a successful company, there's nothing more important than the people that are building that company.
I would say any company, right? Any size.
Exactly. So the talent density and the right mindset, and how you actually the work that they put in really matters. And I think so and then these are people, right? This is not a tool that you can just get and replace, etc. So it actually is very, very painful as well. That's one where you'll shed tears. Like, for me, I have when we're making these hard decisions sometimes, or it hasn't worked out because it's an impact that has it goes beyond just me as well. It goes beyond to impact on the company itself. So I would say those are areas, and that's one where I think, looking back, we get, of course, like I'm getting better at it, as I get as I'm making all these mistakes. But also, I think just in general, like we're getting as a company much more just making sure that we're following the right processes, not skipping steps to if we just think somebody is great, etc. as well. And I think that really helps in creating a full thesis on someone before that decision is made, so that you can be with them for the long term.
Well, not just for a large company like Overjet, but even like someone with a dental practice, right? That is advice that everyone should take and everyone should learn and take seriously, because again, we're not talking about just from the business standpoint. Sometimes there's a personal thing too, right? And there's an emotional component too. If you make a mistake when it comes to people, right? So again, that's a valuable lesson that all of us can learn. Now, before we wrap things up, Dr. Wardah, I want to thank you for jumping on and sharing not only your passion for Overjet and sharing your story, but also sharing these valuable lessons outside of Overjet that we can all use. But for those who are intrigued and they want to learn more, they want to see what Overjet can do for their practice, for their organization, what's the best way? Is it simply, again, you guys have an amazing website. Is it simply go to the website and book a demo? What is the best way to learn more about Overjet and to incorporate it in your business and practice?
Absolutely. So we have, whether you go to overjet.ai or overjet.com, you get to our website, and then there's a demo button there, which you can press and schedule a demo and learn more about it. And I think that's probably the easiest way. You can still, probably email, etc. But I would say the fastest way is clicking on the link there and scheduling a demo.
Hey guys, so look, I mean, you can watch all the videos. There's a lot of videos that's been created by Overjet about Overjet. There's all these different things. You can do all those things, but at the end of the day, just like dentistry, you kind of gotta get your hands a little wet, a little dirty, and you just gotta dive right in. So book that demo. So Dr. Wardah, thank you so much for jumping on and sharing your story with us. We really appreciate it, guys. Thanks for tuning in. See you guys next time.